Take it away.
Okay. So I want to welcome everyone to today's Department of Epidemiology seminar series organized by myself and Dr. Erica Walker. It's really my pleasure today to introduce Dr. Phil Brown, who's at Northeastern University. And looking at Phil's work has been it's been fun to look at this and read about what he's done. Phil was actually here at Brown University for over 30 years, working with our Superfund research program. And now is at Northeastern as a distinguished professor of sociology and environmental health sciences, and heading up a lot of really interesting projects there around perfluoroalkyl substance exposure, as well as community engagement around environmental health. And also the director of a T32 NIEHS T32 training program looking at transdisciplinary training around environmental health and social sciences. And Phil's work really has spanned the gamut of things around environmental exposures in affected communities and engagement with these communities. And so I'm really excited to hear about what he's been doing and this. And it's our pleasure to have you here today, Phil. Thank you so much.
Hi. Well, very nice to be visiting my old stomping grounds. And hopefully you can see the slides. And speaking of that T32, Julia Brody, who's also on this call from Silent Spring Institute, the executive director there, is the co-director, as I am, of that training program. Here's the title: Science, Activism, and Regulation in PFAS Contamination Crisis. And I want to make the case that the kind of work I'm talking about really involves a lot of people. So I'm not going to read this list, but I just want you to see how many different scientists and students are involved in this work. And what I'm going to tell you is a story about the most talked about chemical contamination crisis of our time, is the forever chemicals, the PFAS. Over 12,000 compounds. And it's a crisis that's emerged fairly quickly and recently. It's caught a lot of public attention. It's created a lot of activism. It's yielded a rapidly changing regulatory climate, a rapid growth in science. And I think most importantly for me, a model of how community activists, environmental health scientists, and social scientists can engage in not just public health research, but in practice. We've been funded here at the PFAS Project Lab since 2015 by NSF and NIEHS. And our website here is really the main news source, as well as the source of a lot of other material for PFAS. And we get thousands of visitors all the time. So if what I'm talking about interests you, this is one of the places you definitely going to be checking out. When we first started this work in 2015, nobody even talked about PFAS. We talked about PFCs, later highly fluorinated chemicals, and we mainly talked about PFOA and PFAS, the two most widely known ones that have now pretty much been put out of use, even though they're still surrounding us all the time. These are persistent, they repel oil and water, they're used in all kinds of applications, and they're very bioaccumulative, especially these long chain ones. They're used every day. We find more and more uses that surprise us. The things we heard of originally were nonstick cookware, waterproof clothing, textiles, mattresses, carpeting, grease-proof food packaging. And of course, the things that scare us, like dental floss, cosmetics. Firefighting foams came a little bit later. And even in testing equipment for COVID, we find it. What was interesting is that when we did start this, no one was even talking, and this is 7 years ago, nobody was talking about firefighting foam, and no one was talking about all of the other sources, mainly the production facilities that made it, like the Washington Works here, and the places that used it to make other things like Saint-Gobain performance plastics. We started to find it, though, in landfills, in wastewater treatment plants, and sludge, and the food grown from that sludge, food packaging and septic systems. And as I say, daily new sources. Now we see chrome plating and other metal plating shops. Refineries, any place where there could be a fuel fire is going to have AAA firefighting foam. Municipal munitions facilities, obviously, because they could explode. One of the biggest things now, artificial turf, which has mobilized a lot of municipal action. plastics, dry cleaners, and pesticides. And it's hurting people in lots of ways. The small farmers in Maine are having to get rid of many of their cattle. So it's really touching everybody, and you're going to hear stories of how it touches those people as I continue. One of the things, of course, is the persistence. The older long chains stayed in the body for a long time, up to 7 years. When chemical companies started to substitute the shorter chain ones, they said, look, these are short chains. They get out of the body in a month, very short half-life. But that wasn't very comforting, because all of us know that BPA, which has so many health effects and has been so much in the public mind as a major contaminant, has a half-life of hours. And that doesn't mean that it's not harmful. As it enters the body, it creates that harm, and then it's excreted. And so too with these short chains. So these are some of the claims that industry has made to try and downplay these substitute replacements. These chemicals have been around for a long time. Teflon was discovered in 1938, and they started to use PFOA very widely by the 50s. And 3M, the other major company, started to sell Scotchgard, which was PFAS. And then food packaging began much earlier than we thought, back in the 1960s as well. But as soon as they discovered this, as soon as they started to use it, they found examples of toxicity, first in animals, then humans. And as in many other contaminants, when they found birth defects, they would take women off the production line, put them in lower paid office jobs. But they weren't reporting this information to the press, to EPA. They weren't reporting this in the literature. They were keeping this very secret. And indeed, by the time that 3M started to look for comparison untainted blood samples around the world, they couldn't find anybody, because it had spread that quickly. But the real story always, comes back to human interest, and a family of farmers in West Virginia who were selling a little bit of their land to DuPont to dump waste from that factory we showed you before in Parkersburg, West Virginia. And all their cows just got sick and died. And this led to a lot of action. So one of the things, of course, was their own lawsuit, and then later a class action suit. And while DuPont settled with EPA for what's a small amount of money for them, $16.5 million, what's really important is that in the class action lawsuit, $235 million was set aside for a number of things, including a health study. And that health study was really dramatic, because it was the first time that we had a lot of evidence of the health effects. And that was just of PFOA, just the one main chemical there. We'll talk more about those health effects, but the point is that this begins to, as I mentioned, they couldn't find uncontaminated samples around the world, and NHANES couldn't find uncontaminated people in the US. And so by the end of the last millennium, the population had PFAS in everybody's blood pretty much. And daily, of course, news sources, just sample rainwater and you find PFAS, sample ice, you find it. But as I mentioned, the study that was an outcome of that settlement was a very important one. And the C8 Health Panel worked for 8 years, and they came up with a very amazing amount of evidence from what was at that time the largest epidemiological cohort in environmental health, over 69,000 people. And they found that thyroid disease, kidney cancer, high cholesterol, ulcerative colitis, pregnancy-induced hypertension, and testicular cancer were all associated with PFOA exposure. And later, of course, more people started to do more research. IARC said that PFOA was possibly carcinogenic. We found evidence of immunotoxicity, hormonal changes, liver malfunction, obesity, a lot of reproductive outcomes, and other cancers, prostate and ovarian. And then, of course, that raises the question of what about regulation? Well, none of these chemicals were regulated, even though Safe Drinking Water Act does regulate over 90 chemicals, there weren't any PFAS included there. And while there still are not, EPA is probably in the next month or two going to release their MCLs here. But the story of the discovery here is, the discovery Haynes, the discovery of the Tennant's family farm, and also of the uncontaminated monitoring rule, the unregulated contaminated monitoring rule, UCMR 3, that lasted for 2 years in 2013 to 2015, that showed an extraordinary amount of contamination throughout the drinking water supply. And that was actually very high detection levels and only for fairly large water systems. So the next round, which will start now this year, will have smaller samples, smaller cities and towns, and also a much larger number of contaminants. And the fact that it's a larger number is part of a very large issue that's going on now, which is that people don't want to go chemical by chemical because they've seen the regrettable substitution. So there's been a tremendous amount of effort on trying to treat PFAS as a class. So regrettable substitution looks like this. You get rid of one and you see a very rapid decline, but you replace it with another and the incline is just as rapid at the same slope. So it is pretty astonishing how quickly this class-based approach has caught on, because people look back and they say, look, while there were a few successes for TSCA, they did get rid of PCBs as a class. Granted, there were fewer of them than the 12,000 PFAS. But the point is that people are saying that this regrettable substitution, this whack-a-mole approach, is just not working. If it takes us so many decades of government secrecy and corporate secrecy and failure to regulate and not enough science to show these effects, why are we going to do this every time for every one of those chemicals? So industries are already gearing up for this because they see that it's happening in the state legislatures. They're trying to narrow what the definition of the class is and to say that lots of things which really are PFAS are not in fact PFAS because they maybe only have one chain, one carbon in the chain. And even within EPA, there are differences in different offices over what the definition is. But what's interesting is this has become one of those areas where communities are really getting very rapidly involved in science and pushing for this approach. So there has been some regulatory and legislative attention. ATSDR is doing a number of studies, some of them exposure studies, some of them health effect studies. The National Defense Authorization Act has started to include PFAS, and that's really been important because they're really a key actor in reducing the use of firefighting foam. Dozens of state legislatures have banned some of these chemicals in some uses. That changes day by day, and I'll talk later about what's going on in your own state. We've now got PFOA and PFAS as hazardous substances under the Superfund Act, and EPA drastically lowered the health advisory levels, and they're so low that they're just not even meetable by treatment. But it's a sign that people are now understanding how these chemicals can be very detrimental even at low concentrations. And we're lucky that the current Biden administration is taking a lot of action on PFAS as well. But the state action is still small. Very few states overall have done regulations. Rhode Island finally did it last year. But here's a list of what we have up to the most recent Pennsylvania this year. But in no state are there more than 6 different compounds listed. So that again goes back to the class issue that we're going to be doing this 1 by 1 or 6 by 6. It's not going to be sufficient. But we have seen this action. We've seen advisory levels in other states. We have some states that are starting with health advisories that are required in order to get to actual regulatory MCLs like California. And then, of course, states have been doing lots of other things in terms of notification and treatment as well. One of the things that really is interesting when we talk about public and activist engagement, though, is in a state not too far from us in New Hampshire, when in 2019, the state proposed these MCLs. And they were actually kind of ridiculously high because if you look here at PFOA and PFAS, combined, they would be 108 parts per trillion. That was already higher than the EPA's advisory level at the time, a non-regulatory advisory level. And so people around the state were very concerned, and many environmental groups, as well as legislators and ex-legislators, put a lot of attention to this, and also brought in some new science from toxicologists in Minnesota who were putting their own MCLs forward, and they reduced them dramatically, as you see in the bottom. So just a half year later. So the point is that you could really have a lot of public effect on this regulatory system, even in a short period of time. But also the companies, despite the fact that they're being sued and paying out enormous amounts of money and losing very many investors, they still sued the state. They said, you didn't follow the guidelines and how you did this right. The state came back very quickly and said, if you don't like how we did it in the state regulatory agency, we're just going to go pass a bill in the legislature, and that will take care of it. And they did that very quickly. So that was a very courageous and smart thing to do. In my state, we've got a government that's really been out front a lot. We were very at the top of the states putting forth MCLs here, and they were some of the strongest in the country. And we have a very powerful interagency task force that's also done a lot of great work too. And we've gone beyond what needs to be done. Massachusetts tested smaller systems that weren't covered by the UCMR3 test that EPA did. And then they later followed up with a program to sample private drinking water wells, because a lot of people have those too. In your own state in Rhode Island, you have now MCLs that, just like Massachusetts, and they're going to start this year being enforced. And then there'll be further work going on in terms of landfill standards, and eventually at the end of this year, a plan for a statewide approach to PFAS pollution. And right now in the State House, there's the Toxic Packaging Reduction Act, prohibits as of January of this year, sale of additional of next year any additional food packaging items with intentionally added PFAS. And what I meant by this year, what's in the Senate is Senate Bill 16. That's a comprehensive act. It's very similar to what's going on in Massachusetts now. That includes a lot of things not yet included. So all kinds of textiles and furnishings and apparel, cookware and foam. I'm particularly happy about this because Senator Coleman here was my student when I taught at Brown. So it's really nice to see her having worked her way through the Pawtucket City Council to the state Senate. One of the reasons that we didn't act quickly is because we didn't have a lot of information. We didn't have enough science, and there were barriers to that information. A lot of confidential business information. People discovered that EPA was turning around applications for new product uses in a matter of hours, and they had so much proprietary information withheld from them that companies don't have to give EPA any information about the compounds within something. They can just call it some mixture. They give it a name, and they don't have to tell you what's in it, even though it's the regulatory agency for the whole country. Only in the last couple of years has the toxics release inventory required PFAS to be included. And within a year of the first requirement of this, only 38 facilities in the whole country reported any PFAS emissions. And of course, a lot of small facilities are exempt from TRI as well. There's been a lot of industry denial and falsehoods, industry suing the state, like I mentioned the case with New Hampshire, and we still don't know all the sources. A lot of regulation happens not as government regulation, but as corporate regulation. And there's been a lot of pressure on companies. Some of them have been very quick to take action. So some of the bans that we've seen, Washington was one of the first in terms of food packaging. But we also had companies doing their job, like Co-op Denmark, saying, we're just going to get rid of it. And some of the very large firms have said, we're going to get rid of PFAS as well. Now, you have to look at the labels when people do this, because they'll say it's PFOA-free or PFAS-free, PFOS-free, but they're not going to tell you that the entire class of chemicals is out of there. But there has been a lot of power of the journalists. Consumer Reports has been pretty good about this. And the chains are doing more and more to eliminate these forever chemicals. We're just consistently seeing action. Obviously, the Northeast where we live has been really good in a lot of chemical policy, and this is certainly one example. California has also been pretty good. Court cases, as I said before, the companies are getting hit hard, and this is reducing their ability to attract investors. And some of the large unions and statewide pension plans are starting to withdraw their funds as well. What I find particularly interesting wearing my social science hat is what we call a multi-sector alliance, where you have so many different players involved. Certainly the affected communities, once they discover what they're exposed to. The academic and the regulatory scientists, the scientists who are working directly with advocates, a lot of military and veterans, certainly environmental and health, social organizations, social movement groups. But water utilities, even though they are going to be forced to spend a lot of money cleaning up and filtering, they're on this too. State and federal legislators and regulators, federal research funders like NIHS, which has been really the leader in putting a lot of money in PFAS research. The supply chain manufacturers, the lawyers, the journalists. And this was something that we discovered back with flame retardants when you had this multi-sector alliance. We came up with that idea, but it's even more profound in the case of PFAS. Firefighters have gotten even more involved than they were. So what do we do in our lab? We've done 174 interviews so far with every different group, science, industry, government, journalism, activism. We spent a lot of time doing observation in EPA offices and other places and spending a lot of time in community groups. We've gotten historical documents from industry archives. In particular, we got the EPA docket that the lawyer Rob Allott, who ran that DuPont case, told us about, and we were able to get that in 2016 before Trump took office and started to make these things harder to get. And we added that to the Columbia University Toxic Docs database, which is a tremendous source, not just for PFAS, but even before that on lead and polyvinyl chloride, and increasingly many other chemicals as well. We do a lot of community engagement. We work with community groups around the country. We've helped them get experts. We've written grants together with them. We've organized conferences and sessions at conferences. We've done presentations. Our work, something that we view as very community driven. But we also work with government whenever they want to hear us. And we've served on review panels in states at the federal level. We've testified, we've given expert witness information. We've been down there even in Rhode Island on that PFAS ban in food packaging. Lauren Richter, who used to teach at RISD but now teaches at the University of Toronto, was very involved there. We've assisted other states trying to set up their own PFAS task forces, and we were very involved in the National Academy's guidance on PFAS testing and health outcomes that we were chatting about before we got started. One of the other things we did was to start a contamination site database. And we started this really with literally a handful of sites in 2016. And these were primarily the few industrial sites that we knew of. And the more we combed many different records and archives and news stories, the more were added. And we now have 1,785 contaminated sites, but over 57,000 suspected ones, which I'll show you maps of in a minute or two. We're happy that this has been very widely used by state officials, by activists and researchers, and we've gotten a lot of media attention. And it's helped us to get continual funding to study the different ways that the database can be used. It's just a quick screenshot of it to show you what the kinds of entries we have. The location, the kind of contamination, the levels, the websites that had information on it, what's been done, what's been published about it, what remediation has been done. And we used it to make a map. And one of the things that was very exciting was just a few years ago to see Senator Carper, the chair of the Environment and Public Works Committee, pointing to our map up there in the Senate when they were hearing testimony about new legislation. That was a simpler early map that we did. We first started working with the Environmental Working Group, and then later we stopped working with them, and we have now a map that we do together with Silent Spring Institute. And that's what you're seeing now, and these are the layers on it. This shows you known contamination, and you can zoom in, you can get lots of data, and people are using this in all sorts of ways. We started to get the idea of presumptive contamination, where we would see what kinds of industry codes, what kinds of military bases and air bases and crash sites might have used PFAS, for instance, the plastics, metal plating, dry cleaners, other places that were being investigated by states or even considered as possible locations, but hadn't yet been determined to have PFAS. So that presumptive contamination became a very big issue for us. We also have this in mind as a resource for communities, so we show where there are community groups located and how people can get in touch with them. And we also can show what the state action has been. And this is just continually being updated and used for a lot of things. When we first published this, we were really kind of amazed at how much attention it got. There were 83 media stories about it, over 18,000 views, and altmetric score was 750, which is just amazingly high. And we were surprised how much attention there was to this. So we also tried to bring together all the different people we've talked about, and we've had now 3 conferences in 2017, 2019, and 2022 that were very unique in bringing together activists, scientists, state and federal people, health and environment people, journalists, pretty much anybody who was doing anything in the world of PFAS. And they were just wonderfully attended. They were, as I say, unique in having such a community-driven approach with enormous numbers of community speakers. We couldn't, even with 2 fully packed days, do it. So even though we had 2 days in 2017 and 140 attendees, by 2019, we had almost twice that number, and we had to go to 3 days. We were also really happy that the community groups who played such a role in organizing then formed a national coalition around it. And that group now has over 30 local groups, and they really do exert a lot of information, a lot of attention and influence, and produce a lot of information. Just some shots to show you the folks who were there and some of the faces. Gina McCarthy there, ex-EPA administrator, and most recently from June of last year. It was moved to Wilmington, North Carolina, because the community group said, we love how you do it at Northeastern, it's great. And we want to now have it in a place where it's a major contamination site. And as you may know, DuPont spun off its Chemours company, which has been producing one of the substitutes, Gen X, that's contaminated a very large chunk of the entire water supply of the state of North Carolina. So some of the social science contributions that we have made here are what we call unseen science. The science that's just not only undone, but unseen, because there's so much this that we discover from those EPA documents that I mentioned before, and from discovery in the 3M case, where we continually see how much was done by 3M and withheld. We're also looking at chemical regulatory pathways, the way that states influence other states, and the way that companies try to stop that influence. And we're looking at science opportunities, how do activists use science to further their work in the field. Just a couple of recent studies that we've done. But I wanted to talk a little bit about some of the uses of the map. What we've started to do, and this is work that's not published yet, but I'm still going to show you, so don't take any screenshots of it. We've used our map to show tribal boundaries and to show that tribes are adjacent to a number of PFAS sources. And that if you add 2 or more sources, that 80% of all tribes in the country are within 10 miles of at least one source. We realize that there are some pitfalls in using this kind of data, especially when there's testing, because certain states light up, Michigan, New Hampshire, California, and it's because those states do more, and also because communities that have more social capital on their own, they have more resources and technical capacity in those states as well, they can get more done. And then the large water systems, which were sampled by EPA's UCMR testing, will produce more data. And not so many states are doing their own testing. Massachusetts is great that way. New Jersey is great that way. But testing has overlooked private wells. It's overlooked small water systems. And it hasn't done enough to look at what we're now seeing, soil, wastewater, landfills, sludge. So we've also had the occasion, since I mentioned New Jersey, to look at their data. They tested all drinking water systems in the state. And we decided to look at the environmental justice implications there. And we show that if you look at the text, that Hispanics and Asians and Blacks are all higher than non-Hispanic whites. And that shows you a very important thing about the differential distribution of these. We hope to be doing this as well in California and in other states as well. But again, the benefit there was that the state did a great job of testing all the water systems. We have done sampling through our work with the Superfund Research Program. Northeastern's program is in Puerto Rico, and it's a place that's been very understudied, and we think of it as an entire environmental justice island. So we're sampling there. We also have samples that we've done with our with 3 tribes, and we are in the middle of analyzing those in the lab too. It's just a diagram from a recent article that we published in One Earth, which is part of the Cell family of journals, showing the many different ways that different interests, community, corporate, scientific, and governance, can interact and intersect, and lots of different ways that we can be tracing the pathways of work on PFAS. I want to just touch briefly on a project that we are doing here. Sorry, this is going back. It doesn't want to stay on that. It's called PFAS Reach, and it's a project with Silent Spring Institute. Laurel Shader and I are the 2 multiple PIs. She's the lead on this, and also Courtney Carrigan at Michigan State University. And you'll see some photos, some logos of our community partners as well. This was prompted by studies of immune system toxicity showing that children with higher exposures to PFAS had lower responses to DTaP vaccination. And this was in line with what the National Toxicology Program was talking about early on, that there were indeed immune hazards from PFAS. So what we're trying to do is to quantify the associations of serum for several of the PFAS with DTaP vaccinations, and also do metabolomics of the information. We're also doing that informational and engagement work that has resulted in the map, but also in a lot of work doing medical guidance documents, health guidance documents, and things of that sort. I'll show you that in a few minutes. We've also been doing interviews and observations with those communities to see how it affects them. This is the kind of report back we give, and this is based on work that Silent Spring has been doing for a long time on reporting back data. This is the kind of example where you can show somebody their level and show it in relationship to a cohort, to an NHANES average, and to other kinds of benchmarks. And so this is what we're going to be using as we report this back to people. And the digital digital exposure report back interface, DERBI, is a beautiful tool that has been used in a number of studies so far to show people, what the contamination is, where does it come from, and how to avoid exposure. These are the community partners. You see, we have a number of community partners in our two sites on Cape Cod and Portsmouth, New Hampshire, and Slingshot, which is a New England-wide group. As I say, we're analyzing community experiences. We interview people about what this means to them. We interview government people and water systems people. And we have also had a remarkable amount of success doing medical guidance documents. So here's an example of some of the documents that we have on our website. It's called PFAS Exchange, which is the website for PFAS Reach. And it's hosted at Silent Spring. So if you ever want to learn more about medical information, about vaccination questions, anything of that sort, if you want to go to your doctor and tell them that they should be screening you for PFAS exposure, we have that. So this is an example of guidance for clinicians and patients. There's one version for people, for patients, one for clinicians. Can tell them exactly what tests order if they want, what kinds of screening they should be looking to do. And this has, of course, been vetted through our medical professional colleagues and has now led to a continuing medical education exam course that has been launched through Children's Mercy Hospital in Kansas City. So again, these are some of the other things. We tell people what blood testing can tell them, what it can't do, how to interpret it. There's a tool on the PFAS Exchange website that tells you how to interpret the results. We have information about what labs offer blood testing. This is an example of another kind of thing we can do, show people questions about vaccine response. People are worried, do they need to get their kids revaccinated? So we talk about all those questions here. These are some of, in a little larger print, the kind of things that are shown there. We published this piece in Above the Fold about that. And I want to just give you an example of the power and creativity of community groups. One of our partners is the Nantucket PFAS Action Group, largely working around firefighter issues, both firefighting foam, but also PFAS being used in personal protective equipment. And what's important here is that the leaders of this said, you should do a workshop for the hospital and the Board of Education. And we agreed to do that. And the more that we talked about it, they said, you know what? Why do it so locally? Let's do it nationally. Let's have a CME course for the whole country. And indeed, that's what we did. It's now live. As I say, it's supported by Children's Mercy Hospital, where the Pediatric Environmental Health Specialty Unit for Region 7 is located. And it's available free for physicians, but it's also designed to be viewed by the average community partner as well. The average resident can see it, make sense of it. It's got not only medical information by physicians, but also testimony by affected community residents. So I know I've covered a lot, and I just want to give you a sense of what this PFAS world looks like at this intersection of social science and environmental health, and how many different things we can do with it, whether it's education, research, policy, community engagement. Any kind of professional can be involved in this. We are always making new friends, allies, and partners. There's so much going on. If you visit the website, pfasproject.com, you'll see a lot of that. That website itself is part of the Green Science Policy Institute. They have 3 different foci: news, science, and policy. And essentially their news feed is us. We published a lot on this. I'm not going to read these off to you, but we have since 2016 published quite a number of articles and have a lot more under review. So that's all I've got to say. Thanks for your attention.
You're
Joe,
muted,
you're
Joe.
muted.
Oh, I'm sorry. Thank you so much, Phil. That was great. Um, I want to open it up to questions from students, postdocs, and others, both in person or online. So please use the raise hand function if you're online. Brady, if you can facilitate that there on in 375. And you're also welcome to use the chat to ask any questions. So I'll since no one's jumping up out of their seat yet, I'll ask one. So, you know, that it struck me as you were going through this, Phil, that, you know, there's a lot of analogies to lead. Like everyone likes to make analogies to lead, sort of the first toxicant. You know, do you think it's fair to point out to some of these make some analogies to lead in terms of the way things have been regulated around PFAS? And, you know, when I sort of look at it, I see how quickly everything has moved on PFAS. You know, it's like going from 0 to 60 in you know, in a couple of years, whereas lead, it's taken us decades just to get it, you know, banned and paint. And then, you know, we're still dealing with, you know,
Right.
lower levels of toxicity and arguing with CDC about whether, you know, 10 is harmful versus 5 micrograms per deciliter. And so I wonder if you have any thoughts on that.
Well, it's interesting, you know, because the two prime examples of great evidence and great actionable approaches are lead and tobacco. And both of those were examples where the companies withheld information and fought like the devil to keep people from knowing all this information. And they fought the regulators all the time. And there were decades and decades of evidence already out there before government was willing to act on it. So there is something very similar there. In terms of lead, what's really important also is that Herbert Needleman, who is really the great original founder of all this research on lead poisoning in children, was harassed and hounded terribly for his work. His whole academic career was ruined by the work he did. He couldn't get regular appointments, and he was just harassed. I mean, very similar to what had been done to Rachel Carson. So it's a situation where even when the evidence is just so crystal clear, there's so much government resistance, and even, you know, within the scientific community, a lot of resistance. I think we've learned some of those lessons, and I think that since then, there are so many active community groups. There are more sympathetic people in state and federal legislatures. So once we kind of found out the information, we could act a little bit quicker. So I'm hopeful there, and I've never seen anything happen as quickly, you know, especially for an environmental contaminant that most people still haven't heard of. So it's very impressive that way. But it wouldn't be happening without a core of very dedicated scientists, many of whom are working hand in hand with community groups. And certainly wouldn't happen without those community groups pushing really hard.
Yeah, it is interesting because, I mean, the other, you know, example is sort of air pollution right now. Like, you know, again, there's a lot of push to regulate it even harder, you know, but again, the seminal studies on that were published, you know, 40 years ago. You know, some of the original ones by Dockery and Pope, and, you know, they're still fighting to this day to reduce levels of to regulate air pollution at lower levels.
Right. Well, there are two, of course, industry sued. And not only did they sue to stop the work from going on, but they sued to make people's private medical records public. So it was one of the very biggest assaults on medical records privacy in history. So again, a case where anytime you have effective science and incipient regulation and sometimes real regulation, there will be that fight. You know, it went to the Supreme Court, which ruled for EPA, and even after that, EPA was very reticent to start regulating PM 2.5 particles. So they were afraid that they were going to be harassed and hounded, perhaps in Congress, if they did that, despite the fact that the Supreme Court had ruled against industry and in their favor. Yeah. So yeah, we're never going to stop seeing industry fighting here.
Yeah, yeah. Other questions from in person or online? In person, folks, I don't know if Brady or Brittany are there, if you're going to use the microphone at the front or not. Steve, go ahead.
Hi, Stephen Buca. Phil, thanks so much. I don't have a question. Just wanted to let you know that we're out here. We are appreciative and admire the work that you're doing. So thanks for the talk today.
Thank you. It's nice to hear that.
Hey, I had one other comment, Phil, or question actually about the map you guys made. Specifically, you know, it's national right now. Have you given any thought to looking at it internationally?
Well, I didn't give you this as a lead question, but you know, you're right on target. In 10 days, there will be the release of a major European mapping effort from an investigative journalistic team. And I won't say where yet because I should preserve that part of the embargo, but a very major European publication will have a European-wide map that we consulted with them on. They used our methodology, and it's a remarkable product. So keep your eyes out. It's going to be either February 23rd or 24th.
I have a feeling which major European publication it will be, but you don't need to reveal. But yeah, no, that's great. I suppose there's a lot of challenges. You know, it's easier to do in Europe in a place where there's good documentation. But if you were to go to some, you know, other places where there may be a lot of PFAS pollution, like, you know, I don't know, China, Africa, you know, places where we just don't know. Again, it's unseen, so it's going to be very challenging.
Yeah, well, another one of our projects, actually, we have been gathering information, or more accurately, the lack of information in many countries on PFAS. And it's pretty striking. Along those lines, the World Health Organization has published some draft guidance on PFAS. And everybody in the PFAS world is really upset by it because they're extraordinarily high levels. The review process was very untransparent. A lot of pro-industry folks were allowed to have their say in it. And it's got very, very high recommended drinking water levels. We're hoping that there's going to be a lot of opposition to that, and that's going to be changed when it finally gets moved from draft to publication. But I mention that because when you look at a small country and you say, well, do they have the technical capacity? Do they have enough scientists, whether in academia or in government agencies, to do this kind of work? The answer is often no. And we see that states here in the US don't have that. I'll give you an example. New Hampshire, which has been a real leader in the country, they didn't have a toxicologist on staff until, you know, around 2018 who knew anything about PFAS to help guide them through all this. So you'd be surprised how low the level of expertise is, even in states in our country that really want to do it, but countries in other parts of the world, they just don't have that ability. And they're going to be using the WHO guidelines. And if those guidelines are too high, it's going to be very unprotective.
Any other questions? Otherwise, we'll end a few minutes early. Well, thank you again so much, Phil. We really appreciate you taking the time to do this, and this is really interesting work. I've been following it, of course, and I look forward to seeing more come from you and the PFOA project.
All right, nice to see you all today.
Bye, everyone.